All right, hi everyone. I'm Uzma Siddiqui, a therapeutic endoscopist at the University of Chicago, and I am very excited to have Dr. Aras Sahakian, fellow therapeutic endoscopist and my favorite former fellow, who's at USC, and he's going to be demonstrating hemostasis techniques, specifically using HemoSpray by Cook.
Thank you, Uzma. Nice to be here today.
It is. California is great. I know, much better than
nice
Chicago.
Weather.
Yeah.
Yeah. So today we have the HemoSpray device. This is a hemostatic spray agent. Should we just first talk about how it works, Uzma?
Yeah, go ahead. We'll talk about the device, and then we can get into a little bit of when you would choose this over maybe different products.
Sure. So the great thing about HemoSpray is it's actually very simple to use. We use this all the time in our GI lab. The device here has several components to it. When you open up the device and you want to start using it, the first thing you want to do is activate the device, and that's down at the base of the handle here. So,
well, first, before you even touch the device, you want to make sure you use air and flush out your scope.
Yes, good point.
You do not want to get things clogged up, so make sure you get all liquid out of the scope, and then when you're passing the catheter, you're going to have a little bit of an air flush with a syringe attached, and just keep positive pressure so that you don't want to clog the catheter on the way down.
So everything we do in this procedure is really trying to avoid clogging the catheter. So as Uzma mentioned, we do several air flushes with a 60 cc syringe through our endoscope channel to clear that out, get all the moisture out. You want to avoid using suction on your scope to draw moisture into the channel. Once we activate this by turning the base, we're going to start passing our catheter down. And when we pass our catheter down, Uzma mentioned one of the techniques we use, which is putting a syringe with a Luer lock on the catheter and applying gentle pressure on it with positive pressure to avoid any fluids getting into that catheter. That works really well. Another technique that we sometimes will use is just you can also hold your thumb over it so fluids don't get in there.
That's a good one.
Personally, I think the syringe is a little bit more reliable to have some positive pressure, but if you don't have a very sort of moist environment in there, you can probably get away with just using your thumb. And then, of course, when you're ready to spray, we have our valve here, and we're going to point the valve forward to get ready to spray. And the endoscopist obviously is going to aim the catheter in the patient, and your technician or your fellow will go ahead and press the trigger button. To go ahead and fire the hemostatic material. Generally, we're using small pulses, and that can kind of help with your visualization to avoid it getting too cloudy.
I think we're going to show on the model once.
Yeah, we'd like to do a demonstration here on the model, so if we can just focus on that there. So we're just going to go ahead and give some pulses of the HemoSpray here, and we can see that there is actually some velocity to the spray there. Something to keep in mind. So when we're aiming at a lesion, Uzma, maybe we can talk about some strategies to try to avoid really difficulty with visualization.
Well, I was going to say one of the reasons why I really like HemoSpray in a situation where you have really bad visualization, it's just massive bleeding everywhere, and you don't have a specific target. I think compared to other products, this spray is so diffuse. So it's nice to help just kind of slow things down, and then you can start washing and try to figure out where the lesion is, though. And I liked your technique, though, of the kind of pulses, because that's a little bit of a downside. Sometimes you get a whiteout on your view, and sometimes even your scope can get a little bit sticky, especially in the esophagus. So I think the intermittent puffs are pretty good.
So we'll get to the stickiness, because I think there's some things we could troubleshooting we could talk about there. But I think one of the things Uzma talked about is difficult locations. So sometimes you can even bounce it off of walls. And we don't actually want to be too close to the lesion. We want to be a little bit far away. The visualization's better, and you can cover more of an area.
And I think that's the beauty of it for any user. Again, ideally, or in theory, you think this lasts 48 to 72 hours, so it can just get you out of trouble in the short term. And then we were talking about indications for HemoSpray.
Sure. Yeah, so I think while we have time, the indications are really important. Obviously, we're talking about salvage therapy where our dual modalities aren't necessarily working. We try to cauterize an ulcer bleed and let's say it gets worse. This can really be a life-saving measure in that situation. And potentially temporize these, or sometimes even really work as monotherapy. And I think we're seeing more data that it can work as monotherapy as well. Important to keep in mind, this can work in the upper GI tract and lower GI tract, but it is not indicated for variceal bleeds.
Right. But I mean, I think that's probably one of the more important factors compared to some of the other hemostatic powders or gels, just that this is the one approved for both upper and lower GI tract.
Upper and lower GI.
And Forest One bleeders, which
so I think it works really, really well for a pumping arterial bleed.
Yep,
so it is a very robust agent in stopping bleeds. Other thing to mention is that we can use it in areas of diffuse bleeding, tumor bleeding, so these things that aren't really treated well with other endoscopic agents like clips or cautery. This is an agent that we can use to at least temporize that, if not get some more durable treatment.